Hi there, welcome to my Hogwarts nursery. If you're new to my channel, my name is Shanice Lowe and I'm a doctor of physical therapy and I'm expecting my first baby very shortly. Today I wanted to talk about an issue that's really common in pregnancy known as sciatic nerve pain. So what is sciatic nerve pain? Sciatic pain or sciatica is a very broad term for pain, numbness, and or tingling in the lower back, the hips, the buttocks, or the legs due to irritation of the sciatic nerve. The sciatic nerve is a large nerve that originates in the lower back or the lumbar spine, and it travels down the back of each leg. The pain from this nerve can be caused by numerous things, but during pregnancy, it's usually due to hormonal changes that create laxity or looseness of the pelvic ligaments, which results in compensatory muscle tension that can place extra pressure on the nerve. It can also be caused by the baby's increasing weight within your abdomen, causing added pressure to the joints of the lumbar spine, pelvis, and hips. And lastly, it can be caused by the position of your baby placing pressure on the pelvic nerves, including the sciatic nerve. I was unable to find definitive numbers on how common sciatic nerve pain is during pregnancy, but I just know from my professional experience as a physical therapist that it's definitely not uncommon during pregnancy. Sciatic nerve pain can range in severity from mild discomfort with certain positions that quickly resolves when you change positions to so severe that you're unable to walk and move around unassisted. So there's a lot of variation in how sciatic pain presents itself. There are lots of different treatments you can try for sciatic type pain, including cold packs or heating pads over the lumbar spine and the SI joints. That's just the lowest part of your back and pelvis, because that's usually where the pain is originating from. It's coming from the lumbar spine, even though you may actually get pain, numbness, or tingling going down into the legs. You can also do pregnancy-appropriate stretching and strengthening exercises, targeting abdominal and glute strengthening. Check out my workout videos for good examples. Keep in mind that nerves can be tricky because they often have a delayed response to activity. So please do not try Googling a bunch of different remedies for your sciatic pain if these self-treatments are not helping, because what works for one person may not work for you, especially if you're not aware of exactly what factors are causing your pain. So if your pain is worsening, I highly recommend seeing your doctor of physical therapy, because they will be able to identify what impairments are causing your particular sciatic pain symptoms, and they'll treat accordingly, as well as give you plenty of exercises and stretches that you can do on your own to allow you to manage the condition outside of the clinic. My advice for preventing sciatic pain is pretty much the same as prevention for low back pain, because that's where it's originating. You can use a cold pack to the lower back or a heating pad, or even a contrast of both. You can wear an SIJ belt during the active parts of your day to create some external stability for your pelvis. And you can also do strengthening exercises for the glutes, hamstrings, deep abdominals, in combination with stretching for the tight areas like the hip flexors and the paraspinals. See my mobility during pregnancy workout video for some good stretching and foam rolling things that you can do. So, reminders for dealing with sciatic pain during pregnancy. Remember that the pain is usually originating from the lumbar spine or the lower back and SI joint region. So that's where you should place the cold pack or the warm compress. You want to make sure you're exercising regularly to strengthen the glutes, the abdominals, and the hamstrings, and stretching the hip flexors. Do not haphazardly try specific nerve treatments that you find online, as this can aggravate your condition. So remember, if you're unable to get a handle on your pain, consult your doctor of physical therapy for an evaluation and individualized treatment plan. And go ahead and see the video description for links to some of the pregnancy-specific workouts that I mentioned, as well as a link to my favorite SIJ belt. If you found this information helpful, please subscribe to my channel so you can check out my latest uploads. And if you have any questions or comments, please comment below. Thank you so much for joining me, and I wish you the best on your pregnancy journey.